How do you tell early RA from other arthritis? Identifying early rheumatoid arthritis can be tricky, especially since many types of arthritis share similar symptoms. However, there are key features that can help distinguish early rheumatoid arthritis from other forms. One of the most notable signs is symmetrical joint involvement. This means that if one hand or foot is affected, the other side usually is too. This pattern is less common in other types of arthritis, such as osteoarthritis, which often affects joints asymmetrically. Another important symptom is morning stiffness. If you experience stiffness lasting at least 30 minutes or even more than an hour, this could indicate inflammatory arthritis like rheumatoid arthritis. In contrast, stiffness from osteoarthritis usually lasts a shorter time and tends to improve with movement. Joint swelling, warmth, and tenderness are also significant indicators. If you notice inflammation in your joints, especially with palpable synovitis, it may suggest rheumatoid arthritis. Laboratory tests play a crucial role in diagnosis. A positive rheumatoid factor is found in about 80% of rheumatoid arthritis patients, but it can also appear in other conditions. More specific is the presence of anticyclic citrullinated peptide antibodies, which are more closely associated with rheumatoid arthritis. Additionally, elevated levels of inflammatory markers like erythrocyte sedimentation rate and C-reactive protein can support the diagnosis. Imaging studies can provide further insights. Early rheumatoid arthritis may show joint space narrowing and bone erosions on X-rays, although these changes can be subtle at first. More advanced imaging techniques like ultrasound or magnetic resonance imaging can detect inflammation and erosions earlier, aiding in diagnosis. Duration and persistence of symptoms are also critical. If your symptoms last longer than 6 weeks and involve ongoing inflammation, this supports a diagnosis of rheumatoid arthritis. It's also essential to rule out other types of arthritis, such as osteoarthritis, gout, or psoriatic arthritis, which have different clinical patterns and lab markers. Classification criteria for early rheumatoid arthritis often requiring the presence of at least 3 specific features, including prolonged morning stiffness, arthritis in multiple joints, and positive laboratory tests. Meeting these criteria enhances the accuracy of diagnosis. In summary, recognizing the characteristic symmetrical small joint inflammation, prolonged morning stiffness, and specific laboratory and imaging findings can help distinguish early rheumatoid arthritis from other types of arthritis. Early diagnosis is vital for starting treatment that can prevent joint damage and improve long-term outcomes. Always consult a healthcare professional experienced in rheumatology for an accurate diagnosis and personalized management.